And joining us to talk more on the subject is the doctor himself, Dr. Chris Stanoshek from the Smile Design Studio of Omaha. Welcome to the show.
Thank you, Rachel. Thank you.
I think for many people, if they're going to maybe not your office, they could be seeing and experiencing some of the things that the lady was talking about in that package. But how at your office have maybe the dentist industry changed?
Dentistry, this is an exciting time right now for dentistry. Dentistry has changed so much just within the past 10 years. When we first opened the office, first off, let me say, when I was a child, I remember going to the dentist, and it took 2 months, first of all, to get the appointment. Then I had to wait in the waiting room for 45 minutes. And then the dentist would pop in, talk to me for maybe a minute, maybe stick me with a needle and leave. We didn't want to do something like that. So what we have done is we have taken a comfortable environment, added some of the latest technology available, and kind of mixed them all together. And we have made a convenient, comfortable, high-tech environment where the patient can actually participate in the actual experience themselves. So.
And you said that you sort of have changed the smell and the feel. How do you do that?
I originally wanted it to be more of a welcoming environment, so even some of the small little amenities, removing the old eugenol smell that most offices had, adding a water fountain in there, nice music, comfortable chairs, that sort of thing. Small things like that really can make a huge difference. Actually, it makes it more to feel more like a home, if anything else, and not really a dental office.
And you've also changed the way the feel is with your actual instruments. They're not your standard instruments that you maybe have seen at other dentist offices.
True, true, true. Years ago, well, it's still used a lot today, but everybody remembers the little hook when they're looking for cavities. The dentist will stick you with a hook to look for a cavity. Uncomfortable, noisy, annoying if that. Nowadays we can use lasers to find cavities. It's actually a lot more accurate. You can catch problems at a lot earlier stage than some of the old technology that they used to use.
Okay, that's great. That's great. So what do you think is the biggest reason why people don't go to the dentist? Because there's a lot of people out there that don't.
Two reasons, actually. First reason is fear of pain. But with the advent of microdentistry, a lot of times the shot is not needed. Catching problems early on through the use of lasers and things like that, you can catch them before they become a problem. So pain a lot of times is minimalized, if not gone altogether. The other reason is that they don't have dental insurance and that their dental insurance won't cover it. I find it funny that you know, someone may go once a month and have their hair colored, perm, dyed for, you know, say $300, yet they won't go 6 months to have a checkup and a cleaning, which is a lot more important, in my opinion.
What problems can happen down the road if you don't see your dentist on a regular basis?
You know something? A lot, actually. Catching problems early on is going to prevent things like smaller problems becoming more major problems, serious infection, progression of gum disease, periodontal disease, that sort of thing. Catching those early on is so important. And not only that, cost. Procedures become a lot more costly if you put them off. Routine maintenance is a lot less expensive than going in and having to have a root canal or a crown or some major work done.
And people can also go to the dentist for issues that they maybe have not thought of before, like if you have a migraine headache, a dentist may be the right place to go. Are you finding more people are coming to you for that, or people are learning more about that?
Yes, with the advent of what's called neuromuscular dentistry nowadays, the integration between the way your jaw fits together, the way the muscles of the head and neck work, and the association with migraine headaches. Some very, very strong research out there, some strong literature out there, and proven techniques in order to help alleviate that pain, treat the migraine headaches, and people are becoming a lot more educated in that also. So
migraine headache, you may want to go see your dentist.
Yes.
You have a big campaign going on right now. Tell us about that.
Change a smile, change a life. Wonderful. We love it. We are so excited about this. What Change a Smile, Change a Life came from. What we are looking for is it is a campaign in which what we are going to take somebody who may not have had the means at one point in order to have the smile that they've wanted, always wanted, and we're going to give it to them. What we are going to do, what we feel is that we feel so strongly about a smile that if you change somebody's smile, you are going to change their life, and you're going to change their life for the good. So throughout this month and beginning of next month, we are taking nominations for somebody who may have always wanted their smile changed, who feel that possibly changing their smile will change their life for the good, to please nominate themselves. And you can go to our website to nominate yourselves, and we're going to give it to them. We're going to give them that smile that they've always wanted. So.
That's kind of expensive.
It can be.
It could possibly be very expensive.
Yeah, yeah. And when you're talking about cosmetic dentistry, it is elective a lot of times, but you can't really put a price on self-esteem, and you can't put a price on happiness, and you can't put a price on how your life is going to change. And yes, cosmetic dentistry is expensive, and that's part of the reason why we're doing this campaign, is to be able to offer it to somebody that possibly could not have had it because of it. I mean, because of the cost. They don't have the means to do it, and that's why we're doing this.
So spread the word. If you know somebody or you yourself want a new smile, you just haven't had the means to do it, now is your chance. This is a big chance, big opportunity. So nomination deadline is when? Nomination deadline will be the end of this month. So July 1st. Okay. But you can go to our website at www.thesmiledesignstudio.com, and you can nominate, or you can call our office for any details. Okay, one final thing before we go, or maybe two final things. What advice would you give to people out there? What do people, I mean, this is just a reminder, what do people need to be doing every day to maintain healthy oral hygiene? Healthy oral hygiene every day. Well, obviously you're going to hear the brush and floss and all that. But geez, take a look at your mouth. Okay, there's so many people that just do not sit in the mirror and look at their actual smile. Don't wait until something breaks. Don't wait until you think this potentially could be a problem. Get in to see your dentist. Get in before it becomes a problem. Have them look at things. That's probably the best thing that you can do. Good, good. Well, we appreciate you coming on the show. I love it. Thank you. Good, good. And we hope your campaign goes well. Looking forward to seeing who the lucky recipient is. We are too. Thank you very much. Thank you. And for more information or to make a nomination, you can log on to www.smiledesignstudio.com or give them a call, 884-1607. And again, the deadline for the nominations is July 1st. The decision will be announced on July 15th. Now, after the break, it's a home